Good, sir. We want to welcome you to our January the 15th, Tuesday night study session. We ask that you silence or turn off all cell phones. Everyday meetings are televised at Channel 2 at 7 p.m. and at midnight. We have 3 items on the study session, and we're going to be starting with item number 2, presentation regarding the Dwight D. Eisenhower VA Medical Center.
Mr. Mayor and Commission, just briefly, former previous mayor Mark Peisinger and I had a chance a couple weeks ago to meet with the leadership at the VA, including Joe Burks and then Reed Klopfer, who's the director of the office out there, and Joe will talk about that. He shared with us some great information about some changes at the VA and how they're potentially affect our community and those who use the VA hospital. It was such a good presentation that I invited Mr. Burks here tonight to share some of that information with you. So I'll turn it over to Joe Burks.
Not sure why it's not popping up on there. That's weird. Never ever do that.
See, show up and I break things.
Yeah. Sorry.
That's all right. Because the pictures are the cool stuff.
Used to be able to get this out a little easier now.
They like the function.
Sorry, guys.
Stuff happens.
All right.
Thank you. You guys come work for the IT at VA. Sir, first of all, congratulations on the new position.
Appreciate it.
I got to watch that on Channel 2, and congratulations. You had great following.
Thank you, sir.
Which was really neat to watch.
Appreciate
So, and the rest of the commission, thank you. I know many of you, so just thank you for allowing us to come out. Paul, thanks for setting this up. And like I said, he was out at the VA a little while back, and we talked about some topics, and he brought it back to say, hey, why not have the opportunity to come out and educate the commission on what you do. And Mr. Clover is out in Washington, D.C. right now, and they're getting some education on some of these things that we're going to talk about that they're rolling out. So he sends his best and sent me. So that said, I'm going to get you guys, Paul told me maybe 30 minutes. I plan to get a little bit less than that, but whenever I get the opportunity to educate on the VA, I have to take that opportunity. So I'll spend some time to talk about some of the things that we're doing here. This is our agenda, guys, ladies, and we'll talk a little bit about the history of the profile, eligibility. Mission Act specifically was one of the topics that the outgoing mayor wanted us to discuss. Suicide prevention, our #1 clinical priority. And then I want to share with you some of the things that I saw when I came on board 3 years ago and how we wanted to make a difference in the community, not just at our hospital. So, how many of you are familiar with our history out there?
I mean, generally, but I don't
Generally.
know all the dates, but
Okay.
when was it first opened?
Yep. So our hospital was
Yeah.
built in 1930. Started in 1930, was ended and completed in 1933. So we started at the beginning in 1884.
Right.
Believe it or not, City of Leavenworth was notified by the Board of Managers for the National Home of Disabled Soldiers that its offer of 640 acres and $50,000 was accepted to build a disabled home for volunteer soldiers. The first soldier ever admitted to that home was a Union soldier, and that was in 1885. And you guys may have even seen in the news sometime last year, our chapel, built in the late 1800s, caught fire. Right. And it was actually the chapel's home right next to it. That's since been remodeled, and it's now part of our enhanced use lease, and those are put out for rent for low-income veterans priority. So good things going on out there with that. So in 1985, we operated a 447-bed hospital, 45-bed nursing home, and a 650-bed domiciliary. And I tell you that now, 1985, because we're saying, are things changing? Things have been changing since the late 1800s with VA Eastern Kansas, specifically Leavenworth VA Medical Center. So right now, and I'll show you in the next slide what our profile looks like. We're down to 150-bed domiciliary. Doesn't mean we're doing less, it's just things have consolidated over time, and in consolidation, we've also spread out throughout the state of Kansas and into Missouri with what we're doing, so. This is our profile, so the history of our hospital that I just gave you. This is our profile, ladies and gentlemen. So 2 medical centers. We're in Topeka and Leavenworth, and so in 1998 is whenever we both combined and became one healthcare system called VA Eastern Kansas Healthcare System. $330 million budget that you see there, and we started off the fiscal year in a $30 million deficit. We've already made up a lot of that with cost savings. No services have been hampered at all, but we as an organization are always about the bright light, and the idea is to make us better and more efficient. So a lot of those things have come to surface just in the first 3 months of the fiscal year, and we're cutting that budget, and we expect by the end of the year that we will be on budget. So starting out at a $30 million budget. I'll take your attention to the 600 volunteers, about even 300 on each side, Topeka and Leavenworth. Of these 600 volunteers, they bring into our organization each and every year $2 million in light goods and services and hours that they provide. We can't do what we do without those volunteers. So any opportunity you have to send somebody out there, send them. We'll put them to work and let them be of good use to our veterans. And then you can see some of the other numbers there. 40,500 unique patients, and that's up. The last count we had last year was about 36,500. So the unique count is up, which helps us in those dollars that are brought back to us to help, with our budget. And I'll talk a little bit more about that through eligibility and what that means. So again, 15,000 to 9,000 encounters per week throughout VA Eastern Kansas Health System. Eligibility, and I won't labor this a lot. I just give you a couple highlights here, but time in service, 24 consecutive months after September 7th. There are many campaigns that you're automatically eligible, i.e. the Vietnam era and the World War II era. My advice to anybody that's asking, if you don't know, send them to us. Make that phone call, get a hold of our eligibility, and let us work through it for you. You'll hear the topic of, I make too much money. You'll hear the topic of, I didn't serve long enough. There are so many things that our veteran service organizations can work with to get you eligible, and we'll do everything we can to make that happen. So, honorable, and we've often heard that. There are actually 6 types of characteristics of discharge. Honorable being the easiest to get you out there to us, but there's other than honorable, and there's also other conditions, bad conduct, dishonorable, and uncharacterized. None of those automatically disqualify you other than the dishonorable. Now the others, that's worth working with us and talking to our veteran service organizations, our eligibility clerks, to find what we need, what waiver has to be put in, what paperwork do we need. Some of these things can be changed over time. So again, if in doubt, send them out to us and let us find out if we can make them eligible for care. I show you this because of some of those things that I just mentioned. This veteran here has never really believed that he was eligible for care. He had a family member who worked with an employee of ours. They started talking over dinner or something like that. Next thing you know, they were talking to Robert here, and to find out, Robert comes into our eligibility department and finds out he is eligible for VA health care. And that's what we want to educate our community. Let them know. You've served, you've earned it, let us provide that for you. So Robert came into our Topeka side, and he was enrolling that morning, eligibility, brought in all his paperwork, and our executive conference room is right across the hallway from the eligibility. And so what a great opportunity. All of our executive leaders were in there. I went over and grabbed Mac, first of all congratulated him, thanked him for his service, and then I introduced him to the executive leaders that morning. And when the door opened, they stood on their feet. Welcome Mac to our healthcare organization, and Mac was caught talking about that the next several days, about how welcome he was. And so never too old, and really never too young either. We have some young veterans, OIF, OEF, that we want to get enrolled in our healthcare. Many of them get out and they just believe they got it covered. They understand, they don't need what they don't need. I would say, from the time that you transition out of the military, get yourself out there and at a minimum get enrolled. The worst case scenario is you don't, and you wait for several years, and then we've got a whole lot of paperwork that we gotta get completed, found, filled out to get you back into the system. So get out there and enroll, and you just never know. Maybe it's your prescriptions are taken care of for the rest of your life. Maybe you do have insurance, third-party insurance. Your third-party insurance helps us as well. So, again, never too old. And I will go back to this. Number one thing I hear is, if I use it, I'll take up space that somebody else can use. So I'm healthy, I'm a veteran, I don't necessarily need it. Give that to somebody who maybe doesn't have a leg, maybe who's lost his arms, maybe has an extreme PTSD. That can't be further from the truth, because we're a capped system. So if you don't believe you need that much care over time, get yourself enrolled, because your capped system, our cap system, allows me to use your money to help someone else. And so if I bring in 3 veterans, 2 are high need, high care type veterans, this one who only sees a primary care provider once a year, I won't spend all the money on him, so I can use those for other resources. So again, if a veteran out there in the community says, I'm okay, I don't need it, couldn't be farther from the truth. Again, guide them to the VA and let us work with them. Thanks. So, the Mission Act. Again, this was one of the specific things that we wanted to talk about. And moving forward, as a healthcare organization and VA in general, the Mission Act was passed in August 2018. It consolidates VA community care programs into a new Veterans Community Care Program that will help to ensure veterans choose VA by getting them the right care at the right time and at the right provider, from the right provider. So over the next year or so, the VA is going to work to develop regulations to implement the new law, while also developing policies, training staff, and awarding contracts to furnish care. Veterans and their families, community providers, and VA staff can expect ongoing improvements and regular engagement as VA creates this new community care program. I've got a video here. Instead of me trying to talk through all the gray area of all this, our region has already been awarded. And so our care and community providers, we're already working with them and moving this forward. I will show you the video, and it's black and white, what it will look like over the next year or so. So let me get this for you. It may take just a second to buffer.
At VA, we are building a high-performing, integrated community care network so that veterans get the right care at the right time from the right provider. To design this network, we listen to feedback from veterans and their families, veteran service organizations, community providers, and industry leaders and VA staff. We heard several major themes from these discussions, including the need to follow contemporary industry standards and to be able to customize the network to local markets and veteran population needs. Based on this feedback, the new Community Care Network has several important features that improve the care coordination process between VA, community providers, and third-party administrators. This includes distribution across 4 regions along state lines with separate arrangements for Alaska, American Samoa, Guam, and the Northern Mariana Islands. Development of a complementary alternative medicine network. A focus on transparency, accountability, and quality monitoring. Stronger communication between veterans, community providers, and VA, and an emphasis on timely, accurate payments. A key aspect of the new network is that it provides direct communication between veterans, VA, and community providers. In contrast to the previous network, VA directly coordinates eligibility, referrals, authorizations, and medical documentation with community providers. While third-party administrators, or TPAs, only coordinate back-end administrative processes, including claim submissions, claim payments, and remittance advice. As a result, the new network design improves customer service for veterans by reducing handoffs and cutting red tape. Ensures veteran option for community care, providers, and scheduling. And helps modernize processes by moving towards electronic communication between VA and community providers. The new Community Care Network is part of VA's larger efforts to transform VA so that veterans have access to timely, high-quality care.
So in a nutshell, that's what we're looking like moving forward. So you've probably heard of Veterans Choice Program. And what this is doing now is this act appropriates $5.2 billion in mandatory funding for the Veterans Choice Program to continue in providing care to our veterans until the new Consolidated Veterans Community Care Program that we just saw is operational, which they anticipate exactly about 1 year after its enactment again. So August of last year, we're looking at August by the end of this year for all this to be in place. And again, we're Region 2, which you saw, and that's already been awarded. So we're working. TRICARE that you normally heard of is no longer a part of what we're doing. We had TRICARE embedded staff before that were helping. They're no longer there. We'll take over a lot of the role of managing the care of our veterans versus turning that into that third party. So we anticipate a much better, friendlier service to our veterans throughout the community, and better partnerships with our community providers as well. Next topic is suicide prevention, which needless to say is our highest clinical priority, and doing a number of things. Even over the next 2 weeks, there's a nationwide initiative on suicide prevention from VA. And I'll share with you on the next couple slides what we're doing. Even tomorrow at 3 o'clock, we'll be at Casey's General Store with some of our outreach materials. And what we were lucky to do is be in a Chamber of Commerce. We're a board member on that Chamber of Commerce here in Leavenworth, and the relationship, the partnership that we have with them is phenomenal. First class, maybe one of the best in the country. And Brandon Johannes and his team are so on board with us that they agreed to allowing us into every business that's a part of the Chamber of Commerce to provide our suicide prevention materials, our gun locks, our handouts, our card, our veteran crisis line number. And when we shared that with VA at the national level, they're trying to understand how they can turn that into a best practice. They hadn't heard of something like that before. Yes, you can get out into the community, into your businesses and stuff like that, but to have an entire Chamber of Commerce say, yeah, we're on board and we want that, means a lot to us. So again, we want to thank you for allowing us to be a part of that board. So that was one of the bullets on here. The other one is a mayor's challenge, and we're not there in Leavenworth yet, but what I do want to say is VA nationwide, they had a Mayor's Challenge initiative to prevent suicide among service members, veterans, and their families in a partnership between the Substance Abuse and Mental Health Service Administration and the United States Department of Veterans Affairs. It started out in 6 cities nationwide, which were the big boys: the Phoenix, the Los Angeles, the Las Vegas, Houston. The second cohort is another 20 cities nationwide. Topeka, Kansas is one of those cities, which for us is just a huge opportunity, because some of those other cities are still some of your big ones. Your Oklahoma City, Austin, Texas, Kansas City is in the second cohort, Detroit, Michigan. So for them to pick Topeka, Kansas as a next city for a mayor's challenge to help fight this, one, we're honored to be a part of that. 2, it also shows on the work that we're doing at VA Eastern Kansas Healthcare System. 2 years ago, we took our suicide prevention coordinator, Dr. Stephanie Davis, and spoke on the Senate floor on suicide prevention for veterans. And why did we do that? Because Senator Jerry Moran wanted to hear from the ground, from the front desk, from those folks taking those calls and managing that, what it looked like. And so going out and speaking on that put us on the roadmap, and that in turn helped get us on the map for being the next cohort in the Mayor's Challenge. And Governor's Challenge is also coming up. So just some creative approaches that we're doing, enhancing collaboration with outreach in our veteran organizations for social support. Team Fidelis and others are partners with us. Team Fidelis, a couple weeks ago, was out at our Dom, and they're handing out mental health survival kit type things, and it's just there's some thank you cards, there's some things in there that can help them, and veteran crisis line, call number, a lot of different things. And why I say that is because we can't do what we do on our own. I told you that with volunteers earlier. Well, veteran service organizations also come to our rescue and helping. that allows us to work outside of our walls of the hospital. We can do so much in the walls, but healing, in my opinion, takes place outside of our walls, in the community, being connected with others so that camaraderie and partnerships continue to happen. And so Daniel and his team have been out there. They're coming over to Topeka next week to do the same thing. We're going to go on television on Monday in Topeka to talk about this partnership. Leavenworth Times is going to run our story tomorrow with Casey's and other community businesses. They're going to run that on Friday, is from what I understand from Mark Roundtree. And so a number of things going on, and this is a part of our inclusion in the national initiative over 2 weeks. We don't stop at 2 weeks. And that's my director's promise. We'll be where the veteran needs us, when they need us, and however they need us in fighting veteran suicide. It's our number one clinical priority.
We've got a community mental health suicide prevention commission, and I know Team Fidelis is on that. I think you guys are involved in all of our community agencies and the schools and everything, because we have seen such a rise in suicide overall in our communities, so.
Yeah, and I want to mention that too, because it's not just veterans. It is in our school systems. And I remember talking about it at Chamber of Commerce meeting several weeks back when we were talking about this topic, and that prompted our superintendent to talk about it as well. And I think something went in front of our voters just recently on putting suicide prevention coordinators in the school as well. So again, it's a community fight, and we're not alone in fighting this alongside each and every one of you. So more to come on that over the next couple of weeks. New Veteran Crisis Line Call Center. I'm not sure if you're familiar with that, but there's only 3 Veteran Crisis Call Line centers in our country. One's in Atlanta, one's in Canandaigua, New York, and the third was put on our campus in Topeka. And Senator Jerry Moran had a little bit to do with that. But at the same time, it was being in the right place at the right time, putting us in the middle of the nation. And that's helped us be able to absorb even more calls over time and be able to get help closer to the veteran where they're in trouble. And I know some of you are familiar with with a suicide that took place on our campus several weeks ago. Well, what you may not have heard also was there was another attempt on our campus in the parking lot. And because of the Veteran Crisis Call Center and connective activities and quick work, we were able to identify him within minutes of him making a call. And our staff code blue that, saved this individual's life, and he's continuing to get the care that he needs in moving forward. So yes, veteran suicide is incredibly important, and it's devastating. A third of our employees are veterans themselves. And so if anyone in the community would ever think that we don't care, it'd be far, far, far from the truth. So when we lose a veteran, wartime or peace, we feel it. And we just want this community to know that we've got their best interests always in mind. One of the really neat things we got to do last year was host a summit, and we pushed that over to Junction City. This next year, we look at bringing that into Leavenworth, and so in bringing it to Junction City, I'm not sure if you're familiar with the movie Thank You for Your Service, American Sniper. So Thank You for Your Service was set on a team coming back from Fort Riley and what it looked like in transitioning back into the community and the struggles that some of these soldiers went through with the topic of suicide. And so they set those between Topeka and Kansas City, back and forth. And in the movie, one of those soldiers took his life at a bank in Topeka. We got to work with that film crew long before that movie as they came to Topeka VA. And I got to work with some of them and shooting some footage. Not much of it made it there, but we kept the relationships, we kept the partnerships and the communication open over time. And so whenever that movie came out, Thank You for Your Service, the director, Jason Hall, also directed American Sniper, and actor Scott Hayes, we were in contact, and I thought, what better way to reach this summit than have you guys here as our guests and to speak about what you learned while you were traveling down and understanding what these veterans were going through. Both of them agreed to do that. They came out from Hollywood, were a part of our panel and a part of our discussion that was attended by over 300 in Junction City. So whenever at VA Eastern Kansas, when we put on a summit, we do it well, and we do it with real hard thinking, understanding, and coordination. So it's more than just putting on a summit. It's trying to find the best way to get the best message out there to our audience. And we believe we did that with Beyond Thank You.
Do you know when you're going to be doing that
I
here?
don't have our exact date yet, but we do plan to do that on this side. we have not found our big names, our big tickets to bring in yet, but we will continue to work with that. As soon as we do learn our dates, we'll be sharing that just as we shared it out there, and we plan on filling that place up, so.
Love it.
That's just a quick snapshot of our team. Megan Voorhees is probably on the team that you spoke about, ma'am. And her and Joseph will be with me tomorrow at Casey's General Store on 4th Street, sharing some of our materials, talking to their employees, and taking some photos for the coverage on Friday. And then really fun for me is to be able to go over some of these things. I've lived in Leavenworth for 10 years. And retired from the military in 2013. So between 2008 and 2013, I drove up and down 4th Street many, many times, and I saw this thing up on the hill. It was your VA hospital, and I never really went up on the hill. But I looked at it. It's beautiful. Drove through the cemetery every now and then, and far from this did I know that I would someday be their spokesman and their director of public affairs and communication. And so as soon as I knew I was going to take the position there, I thought back those 3, 4, 5 years, what I saw, what I did as I drove up and down that street was, how do I get that hospital out to the community? How do I bring it off the hill and make it a part of what we do each and every day in Leavenworth? And so the next couple slides will show you some of that. We host veteran town halls 4 times a year. We go into our rural communities as well as Leavenworth and Topeka. So you'll see us in Topeka. 3 months later, we'll be in a rural community because I showed you earlier we have 9 rural-based clinics. 3 months later, we'll be in Leavenworth. So we plan to be in Leavenworth at the end of March for our next town hall. And then 3 months later, we're in another rural. So 9 months ago, we were in Fort Scott. Huge turnout. This last one here was in November, and it was in Lawrence, Kansas. So when we do these things, we're trying to think, how can we get the biggest bang for our buck? So we put it on the icons. When we were in Fort Scott, we just asked permission to use Fort Scott Community College. Everybody knows where it's at. Instead of doing it at a veteran service organization, VFW, something like that, we turned it into a city icon so we can get more attendance and more buy-in. So Fort Scott, huge outcome. We went to Lawrence. What's our icon in Lawrence? It's KU. So working with their people over there, got permission, and it just so happens the chancellor of KU is a veteran himself. So making those connections helps us a lot along the way. And so we hosted our last one there in Lawrence, great turnout. And then my trivia for the group over there was, this is what?
Allen
This is
Fieldhouse.
Allen Fieldhouse. Here's a question. Do we know who this guy is?
Max Falkenstein, is that?
No.
This individual right here is Mr. Warren Carmen. I know, I snuck his name in there, but
I was just looking at
he's
that.
the
Yeah.
only surviving architect from Allen Fieldhouse. Allen Fieldhouse is 36
Really?
years, yeah. So Allen Fieldhouse is in its
Like 60th
63rd year,
Yes,
yep,
something like
63rd year, going on to 64. 63, he's the oldest and only living architect in there. And Mr. Warren Carmen is a World War II veteran.
that. That's cool.
And so being able to make that connection as well when we were in Lawrence, be able to share what we do. We have a history lesson in our hallways with every patient we meet. And out in our communities is the same thing. So we, and me as a spokesman of VA Eastern Kansas, love to share the stories of our veterans, and I take every opportunity to do so. Just a number of things that we have going on here. We've got some partnerships, Progressive Insurance. We have an exclusive partnership with this Progressive Insurance that a veteran will receive their car. Our veteran, VA Eastern Kansas patient, will receive one of their cars each and every year. And so that partnership's ongoing. We sent a team down to Puerto Rico whenever that happened. We also sent a team down to Houston whenever that happened as well. So we're out and about in not just our community, but others. This is our DoD VA Sharing Agreement. And these aren't everywhere in the country, so this is very unique, and they're growing more and more to provide our veterans that might not be able to be seen at our clinics based on specialty care, based on numbers. Instead of sending them out to a community partner, send them to the military post, where they may have retired from, where they may have served from, and what a great healing environment for a veteran to go back home to his own fort and get care and services. So we've got a great partnership, a great sharing agreement that continues to grow each and every year with adding more and more specialties. And we do have some here at Fort Leavenworth. It's not as robust as what it is at Fort Riley, but we're also meeting with leadership from Fort Leavenworth later this month to continue to open up more and more opportunities. What you see here is a YMCA in Topeka. I really wish we had a YMCA in Leavenworth. What we did was we went to work with the YMCA there, and what you'll see there on top of their building is our logo. That's fabricated steel. And to have your logo, your healthcare organization, sitting side by side a YMCA logo is huge. And we partnered with them. You can see from the inside look there, they revamped their entire north branch to be an entire military-friendly YMCA. And they gave not only our veterans amazing, huge discounts, they also extended that to those serving our veterans. So our employees at VA Eastern Kansas were also provided some huge discounts. Sad to say, YMCA has just been bought out. Doesn't mean that that's going down. I'm in conversations right now with Great Life, who took over the YMCA, and trying to continue that partnership. And future phases of this will have our employees working inside the YMCA to closely manage transition outside of our walls. Again, I said earlier, we can give you some care inside of our walls. Healing takes place outside in your community. I can't take care of your every single need inside my hospital. But whenever we let you go and you're home from your PT rehab, you don't need pool therapy program anymore. Let's get you involved with the YMCA and join that. And they had scholarships available as well. So the cost was really never an issue for a veteran who might not have been able to afford that. We're teamed up with PGA, and this is Tom Watson. So each and every year he hosts a golf clinic, free golf clinic for veterans with disabilities. That's our OT team up there, and they went over because when you're hosting events like this for disabled veterans, you're certain to have some wheelchair type activities that are needed. And so our OT staff went over there and educated right along with PGA staff. And again, we host this each and every year over at Shoal Creek. Great partnership, and Tom Watson is a huge advocate for veterans. Just real quick over this, we got St. Mary's. St. Mary's is across the street from Leavenworth. And it was hard for me to believe that there couldn't be a partnership whenever I took on board this job. And so very, very quickly, we built that bridge from VA right across the street to St. Mary's, and now we got just a tremendous partnership. We bring their students over. We do health clinics and things like that with them, and we'll take our staff over there and vice versa. And then our classroom to career, so we have high school students from all over the county coming out and visiting with us. We're slated to do it every 2 years, and it wouldn't surprise me a bit if they ask us to host it each and every year. And it's a pretty large undertaking. You can see there from the number of students that are showing up. But we introduce them to a day of what it'd be like to work at the VA or federal health care, and a lot of great feedback. And then this guy right here on top, he's a veteran. And so this is Leavenworth High School, and they did a play called Letters Home from Vietnam. This young man was in our domiciliary, rehabbing through struggles and addiction, drug and alcohol. And so we thought, what a great learning opportunity for the students of this play to come over and learn firsthand what Letters Home from Vietnam really, really looked like. And so they came and spent a day with us at our domiciliary and got to visit with many of our veterans, some Vietnam veterans. They made this young man the guest of honor at their play on opening night. Gave him the seat of honor up front, and just before the play, they took him around back and backstage. And when he walked in, they rendered a salute to this young man. There wasn't a dry eye in the room, to include mine. Incredibly emotional. He turned to me and he said, "Joe, for the first time since I've been home from Vietnam, I feel welcomed in the community." Wow. That was your community of Leavenworth that he said that. And him and I stay in touch still to today. And just what a great moment for your city, for the high school, for those students to be able to really share in the life of a veteran.
Is he still in the Dom?
He is not, no. And then just a few more here, but I'll take your attention. This is Rome Lindsay, MMA fighter. I think we got some MMA fighting going on Friday night here in Leavenworth. So, hey, listen, I'm a huge fan. But Rome Lindsay wanted to give back to veterans, and he said, how can I do this, Joe? How can I take you into the ring with me? How can I make veterans the focus of what I do? It wasn't very long at all. We put him on television. We talked about it. We took veterans down there to Wichita to watch him fight. And he not only went in and fought for veterans, he took us in the ring by putting our logo all over his branding items. And so his shorts, his ring corner, all those things were labeled with VA Eastern Kansas, and that was a Bellator fight, nationally televised, and he more than adequately provided back for veterans in what he wanted to do. And him and I still stay in touch. I went and watched him fight a couple weeks ago, and he'll be back in the ring real soon. And then won't share everything else with you, but this individual in the middle, this is Tim Hornick. Tim Hornick in this picture is just now finishing the Boston Marathon. Tim Hornick is blind. He finishes the Boston Marathon. They shared that story with me, and what a great story. And we thought, man, it doesn't get any better than that, or does it? And so Tim, blind veteran, has been working for several years within his own company to help others be able to see through a device where somebody is on the other side of that device, helping guide them through life. I shared the story with the Kansas City Royals PR team. And on September 11th of last year, they brought Tim Hornick over and the entire visually impaired program.
Cool.
So they're lined up on both sides of that field as Tim throws out the first pitch on 9-1-1. Not only does he throw out the first pitch, he throws an absolute strike.
Oh, yeah?
Absolute strike. And part of that strike is because that device that he's wearing is a part of his company that he's developed. So a veteran that lost his eyesight to a sniper in war didn't sit on his couch and say, woe is me. He said, what can I do to help others? And so just an amazing opportunity to be a part of the Royals that night, to see the crowd standing and cheering for what he's done in service to our country. But just allows us to be proud of each and every veteran that's in our hallways. And then the final slide here is, this is Dan Young, and Dan Young was not expected to live. Matter of fact, Dan Young went to basic training and was given his inoculations, and after that had a very serious reaction to all those. Went into multi-systems failure. Got a little bit better, not enough to send back out to the battle, to basic training, but they did anyway. And so he went back out to basic training, had a relapse, and long story short, ends up at KU Medical Center on life support. Dan couldn't feed himself, couldn't go to the bathroom on his own, wasn't breathing on his own. Was basically on life support. And KU docs came in and said, hey, Dan, we have a surgery to do. And if we don't get to the surgery, you are not going to live. And so Dan Young, still qualified as a veteran, with just a short time in basic training, but he had said to God that night, he said, God, if this is all you have for me, just take me. Please, just take me. So, doc runs in, says we're going to do surgery, goes to surgery. The next morning, Dan wakes up and Dan's eyes open up and he says, okay, so you still have a plan for me. Now, Dan wasn't out of the woods yet, but what they did was got Dan to a point where he could be transferred to our community living center. He spent about 2.5, 3 years in our community living center right here in at the Leavenworth VA. And again, couldn't feed himself, was never expected to do that, wasn't ever expected to live on his own. As you can see him right here, pool therapy. Our classroom to career team got to meet him over in Topeka. We shared his story. Dan went home on his own. Dan's walking because of, one, his fight, but also some of the care provided by our folks at VA Eastern Kansas and the Leavenworth VA Medical Center. And Dan would tell you every day of the week that he would be where he is without them. And his quote was, VA breathed the life back into me.
That's good. That's good.
That concludes the brief. I will answer any questions you have. Again, I thank you for your time. I really
Yes, sir. We greatly thank you for the presentation. I did have a question. Have you all been to the homeless shelter and extended your services? Because I'm very familiar that we have quite a few homeless veterans.
Yeah. There are a number of homeless veterans. We have HUD-bash teams specifically designed to help them out. In the winter, and we'll see that a lot this week, we have a warm haven. In the summer, we have a cold haven. So not that we're the homeless shelter,
Yeah, correct.
but veterans, whenever that temperature is below that 20-degree threshold, we open up our conference room, we've got bedding for them, we feed them, we give them what they need to get them through the night. And while that's going on, our social workers are working hand in hand with those homeless shelters and community partners to provide them housing and get them shelter to get them through the hard time. And that's irrelevant whether you are enrolled in VA healthcare or not. If you're a veteran and you're in need over winter,
Yes, sir.
come find us.
Yeah, that's good.
I have a question on partnerships, and it may go to Commissioner Bowder's point in terms of that organization. Is that out of the guidance center, Commissioner Bowder? I was wondering.
Right.
Okay, so you do have a partnership with the guidance center, and what about the two hospitals in Leavenworth?
Yes.
The answer yes to
I think
that?
so, too.
They're both on that as well.
Okay.
Yeah, it's a community-wide partnership, and we work well with our other hospitals that are in town. There are things we can do better, and as we move into community care and what I showed you, those will get better, because one of the things they will tell you is they don't get paid timely. We don't control that pay process. That was coming through our third party, through our TRICARE, and there were some hiccups with that. We'll get much better in the future with paying our community providers quicker, thus opening up more and more services.
Good.
How long is the partnership with the chamber? How long have you been in that partnership with the chamber?
I've been an ex officio board member since I took on the position here, which is 3 years.
Okay.
And I do know
Yeah.
my
Jim
predecessor,
Gleisberg
Jim
was on
Gleisberg,
for
was
years.
also on there
Yeah.
for several years.
I
So
didn't know that.
How long, yeah.
Okay, good. And then finally, is the VA, is our country making any progress in terms of suicide prevention? Are the statistics still 22 veterans a day, or is it decreasing or staying about the same? Or?
great question, sir. The latest numbers that were shared with us, there are 20 a day. So that's showing you progress. One a day is too many.
Right, I got it.
One a day is
Right.
too many for us, and hence some of the things that you heard me talking about, this national push over these 2 weeks. I mean, the timing is perfect for me to be able to speak to you, but over these 2 weeks, it's just a national push. We're to be on television. We're to be with veteran service organizations. We're to be blasting out social media nonstop. We're to be talking with our city leaders. I'm going to be talking to the Chamber of Commerce on Thursday about it once again. And again, our friends at the Leavenworth Times, can't thank them enough for always allowing us time to be put on the roadmap with what we're doing. They are getting better, still work to be done.
Got it, understand, thank you.
At least it's recognized. When I worked in the VA back in the 70s and early 80s, there were too many young men coming out of Vietnam that were committing suicide. So I know that I'm so glad it is a focus of the VA.
Absolutely.
Hey, thank you for your dedication and presentation as well, too, sir. Thank you.
Thank you, sir. Thank you very much. Thank you.
Next item on the agenda, Riverfront Community Center, Riverview Room Carpet Replacement.
Mr. Mayor and Commission, last year during the CIP discussion,
You
we
can come up here,
discussed-
Tammy.
Thank you, Mr. Brooks.
We discussed the need to put a new flooring in the Riverview room. Normally, something like this, depending on the cost, wouldn't come to the commission, but it's the Riverview room at the Riverfront Community Center. And Steve and his staff, doing their due diligence, has explored some alternative flooring types. And so they're before you tonight to talk a little bit about that and get some guidance from the commission.
Thank you, Paul. Good evening, Mayor, Commissioners. Thanks for having us here tonight. It is budgeted in the 2019 CIP for the replacement of the carpet. You'll recall at our CIP discussions, we talked about some possible alternative options, and the one being what's called luxury vinyl tile, which is the flooring that they have over at the Heritage Center. So that's what we referred to. The current carpet in the Riverview room's it was installed in the spring of 2008, so it's going on 11 years old. The carpet before that got replaced after 8 years, so that just kind of gives you a general idea, 8 to 10 year lifespan on carpet in that room. Obviously, with carpet, it's subject to spills and staining and wear. That being said, it's an iconic room. It's probably one of, if not the best meeting rooms in the entire city, and so many wedding receptions and town hall meetings and civic organizations meet in there. So what we wanted to talk about tonight with this, the luxury vinyl tile, which they call LVT in the industry, is just kind of compare that as an option. And since the CIP discussions, our direction that night, and the commission, you all seem pretty in tune with wanting to discuss it more. So since then, Tammy and myself and Chuck Phillips, our maintenance supervisor, have done quite a bit of research we've had several different commercial flooring vendors come to the community center. We've gone through tons and tons and tons of samples, looked at a bunch of different varieties. We've talked to Scotty and the folks over at the Heritage Center, and we've actually went over there and listened while there was a production going on. Our main concern, obviously, is we don't want to change the room that we currently have, and one of our key focuses is the acoustics of that room.
Right.
Obviously, carpet absorbs sound probably better than any flooring option, and we know that coming in with a different flooring, such as the LVT, it's going to change it. Every vendor we've talked to has agreed, sure, it's going to change it. It's not going to absorb as much sound. To what extent is difficult for any of them to measure or for any of them to predict. The overall general consensus from them is it may be a little bit louder in there. However, they're not too worried about too much louder or too much echo, since we do have lower ceilings, and we have the noise dampening panels in the ceiling.
Which is something you don't have in the men and women's waiting room, where the acoustics are just terrible.
Correct. They have those very high vaulted ceilings in
Right.
there, and that's really, that with the hardwoods combined to really make the sound bad in there.
Mm-hmm.
So we wouldn't be worried about it going to nearly that extreme.
Okay.
But I would be kidding you if I sat here and said that it's going to be as good as carpet, because it's just hard to really determine what the difference will be in that. So with that, the other, the benefits of the LVT obviously is longevity. It comes with a 10-year warranty in the heavy commercial use. Heavy commercial use applications such as ours, with an estimated lifespan of 25 to 30 years. So that is a benefit. Some of the cleanup and the staining that you get with carpet, you don't get with this. But obviously, it's going to make a dramatic change, visual change to the room as well. Some may find it beneficial, some may not. And then the real question is the acoustics, and that's just hard to predict. So that's why we wanted to sit down and discuss it and get direction from the commission. We're ready to go either direction. We're ready to go to replace with carpet, or we're ready if the decision is to go a different direction. So
What's your price comparison on that compared to a yard of carpet?
they're going to be right in about the same ballpark.
That's including installation?
Yes, and removal of the old.
Okay.
Yeah. So
Now, is this a glue down or just lay down?
this is a glue down. The only difference between this and what's at the Heritage Center is it's the same product, but the one at the Heritage Center is a click lock system.
Right.
Where they lock together, and they have some glue on it, but it's more of a floating system. The application, all the vendors said for our application, a glue down would be much better, so that we don't have to have, if you've been in the Heritage Center, there's a big seam down the middle. You can only go so far with that click lock system, the floating system, until you have to have a big seam. So for our application, the glue down is by far the better the better way to go if we're to go this route.
But they are replaceable if you have an accident or for some reason another 7 or 8 tiles got damaged.
Yes,
That
yes.
thing could be.
Yeah, the glue that they use, the adhesive that they use, is responsive to heat, and you literally just take a hairdryer and you heat these planks up. The planks, and I'll actually, if I can pass around. These are the samples of what, if we're gonna go with the LVT, what we would recommend. You can tell it's a pretty thick product. It's actually 6 layers put together. We did a little test the other last week because we were curious. You know, we roll pianos on there and roll a lot of heavy carts in there. So we put these down in the women's waiting room down there, and we rolled the piano on it and set it on it and left it for the weekend to see if there'd be any effects. And as you can tell from those samples, they had no effects on it at all. The actual planks are that same width, that's 7 inches, but I believe they're 48 inches long. And yeah, you just heat them up with a hair dryer, and you can remove one or however many and put one right back in place. So
Yeah, they're good and heavy vinyl.
Yeah.
It looks like your design part goes about halfway through, so.
Is this the color you're thinking of?
It is. There's, we've had, like I said, we looked at several tons and tons of samples and shades. And currently in the review room, there's about 3 different shades of wood going from the hardwoods in the women's to the columns.
I was gonna say, does it go well with the other waiting rooms? I mean, the 2 with the waiting room is adjacent to it, the 1 waiting room, I guess.
Yes.
Does it go with, it would go with that, the
Yeah.
colors and stuff.
Right.
For
And when you
continuity.
go with these LVTs, you're not gonna get that shine, that sheen that you see
Right.
on those other ones. And that's by design, because with a product like this, you do not put down any wax or anything like that. They're 100% waterproof, stain proof, and that kind of thing.
Oh, this is cool.
What's your preference, Ms. Tammy? You're not saying that.
Well, they both have their, their good points. The carpet is, a good choice for the sound. This is a good choice, dollar-wise, because the expected lifespan is much longer. It seems to be the direction that a lot of venues are going. A lot of different places are going in the direction of that. So, I think that they both have a good point to them. It's just, what the commission's preference is.
But I think everything cycles. It's like wide ties, ties and narrow ties is what I'm trying to say. Carpet would be down for, everybody accepts that for a long time, and pretty soon, hey, we gotta have hardwood. And after 10 years, no, we gotta have carpet, so don't throw away your narrow ties.
I think I'd like to go in this direction, but I'm just concerned about the risk with the sound. I mean, because there's no guarantees. And to me, in terms of all the criteria or decision criteria,
Yeah,
cost
we
is
choose-
important, but sound is, I mean, if we mess it
We
up with
choose for that room,
sound. So
dance
I don't know,
music and stuff.
I'm a little uncomfortable taking that risk. I'd like a more, and I know we won't get it, a more ironclad assurance that, it's not gonna significantly
Have the
affect the
echoes.
sound.
Echoes.
So that's my 2 cents as far as this. And I think it would look very nice, no question about that. I'm just concerned about the
Well,
sound.
this is a thicker product and it's softer. I don't know, maybe it wouldn't affect the sound as much as you would with a hardwood.
Hardwood,
I really don't think it would. Not as
It is-
much.
it is-
It will some on the chitter chatter, I'm sure. As far as the PA goes, it may assist it. So everybody.
We have
at the
bigger
end of the
dance
room
floor
can.
then.
Yeah,
The dance floor would be endless. You're correct on that.
Dance everywhere.
Right.
No,
Yeah.
would we bring, what do we do now for?
We bring out a portable dance floor now, and we would no longer use
No,
that,
no, no,
because
no,
like I
no.
said.
Yeah, I like this idea. I'd like to try it. I know it's gonna.
But you're willing to- I
last
mean, you-
longer. I'm willing to put up with that.
And-
I don't think, I honestly,
I think
since
so.
this is thicker and it's soft, it is kind of not hard and not like wood.
Sure.
I think it would work all right for the, Paul.
Yeah, and the only thing that,
Right, that's- we want to take
yeah,
off.
and the only thing I'd add is I did have a chance to talk to Commissioner Preisinger, and he was basically whatever the general consensus was. He said if he was 51-49, he'd probably go to carpet because of his hearing aids, but he wasn't overly concerned about it and thought that whatever direction would be fine.
But what about the waiting room's different in terms of the height of the ceiling and everything,
Yes.
and it doesn't have the acoustic
Yeah, and the hard,
tiles.
you're correct, the hardwoods are gonna reflect the sound a lot more. This will be a little more absorptive than the hardwoods themselves.
Yeah, I think it'll probably be all right.
I think
it'll be
due
okay
to
for
the
sale.
longevity we get out of it.
Yeah, well, definitely from the standpoint of money, I mean, and
We've got to
longevity.
do the citizens justice.
So we got a consensus, yeah.
Yeah.
Okay, well, we'll move forward. It'll go out to the formal bid process,
Yeah.
here over the
I like
next
that color.
few
I
weeks.
think it looks very
It'll look nice.
rich in
Yeah,
there.
yeah, we think it'll look nice.
Pick up what I got.
I was thinking the same thing.
Keep it. Yeah, they said
You have to change
What choice let me
anything,
keep?
once we get the new floor in there, do you have to change anything else, like the draperies or anything, or is all that kind of coordinated?
some of the baseboard will be changed on the west wall, where it goes from the Riverview into the women's waiting room. And as part of this project, we will keep carpet out in the main entry area, around the cage and by the elevator in that area.
Okay.
So it'll be just in the room itself.
Okay.
Which will help, because it's such a high traffic area out there.
Now, this is gonna be all three rooms or just a river?
Just the Riverview room,
Okay.
yes, the
You
other,
get those beautiful floors in the other two.
yes, so they will stay the hardwoods that they are, so. I think that's the only change, there'll be a
What
baseboard.
is there a subfloor in there, or is it
It's concrete.
concrete?
Yes.
Okay.
Right.
Oh, wow.
Okay.
Yeah, so they'll rip up the old carpet, and then they'll bring in a high-powered buffing machine, and then they'll smooth it out, with that.
So this will go right on the concrete, there won't be
Yes.
another subfloor under there?
Correct.
Okay.
And what timeline are we looking at for,
It takes about a week to do.
I meant for the bids, and when are we thinking of?
Oh,
this
I
would
think
actually-
bids have to be publicized for a minimum of 2 weeks, I believe.
But when's
then-
our target date for actually doing the work?
What were we targeting?
Generally.
We're hoping for first week of March.
Yeah, first week of March,
Okay.
yeah, here. Once we get a vendor in place, then we'll look at the books and see what we have scheduled. Our goal, obviously, we don't want to displace any major,
Events, right.
we can't displace any weddings or anything, and we move Lions and Rotary around. They're used to being-
You know we love it, yeah.
They're used to being moved for
Yeah.
different things, but we can get it done in a week's time, so we'll between the vendor and the schedule, we'll work that out.
Okay,
All right, thank you.
All right, thank you very much.
thank you.
Last item on the agenda, discuss changes to the cereal,
Want these back?
discuss changes to the cereal malt beverage license
No,
rules.
I'll take one home.
Our city clerk will handle this item.
Let me show this to Greg.
Serious?
Mayor and Commission, during the 2017 legislative session, there were major changes to regulations regarding the sale of, referred to as strong beer in establishments such as grocery stores, C-stores, gas stations. Prior to the change, establishments are only allowed to sell cereal malt beverage, which is also referred to as 3-2 beer. The changes that they came up with in 2017 become effective April 1st of this year. So in anticipation of the changes coming up, the League of Kansas Municipalities has prepared new model ordinances for cities to adopt. All licenses will be, or all businesses that are licensed for CMB will be able to sell beer containing not more than 6% alcohol by volume. The city ordinance only refers to the availability to sell CMB, so the new model ordinance for the sale of the enhanced cereal beverage, which is defined as a combination of CMB and beer containing not more than 6% alcohol by volume. The Director of Alcohol Beverage Control has established rules to allow CMB businesses to accept deliveries of beer not containing more than the 6% alcohol to begin on March 1st, so that the businesses and establishments can start getting their inventory ready so that they're able to start selling that as of April 1st. Staff will begin working with the city attorney. I actually think he's already begun some work on it to update Chapter 10 of the city's Code of Ordinance to incorporate the changes that are required by the state statute, and to bring the ordinance to the governing body for first and second consideration, so we have those in place prior to April 1st. So this is just kind of let you guys know that we're going to be working on that. It's going to come, and the changes that we're going to do are all governed by state statute and what's going to be required for the sale of CMB starting April 1st. So
Yeah, our
those will
intent would be
coming up.
to, for lack of better terms, repeal and replace Chapter 10, because we'll clean it up as well, but this is not a circumstance like the massage establishment where there's a feedback component and all that kind of stuff. All of our changes in our new Chapter 10 will be dictated by the new state statute.
Got it.
When we talked about this roughly about a year or year and a half ago, we foreseen this coming.
Right.
And one of the concerns were the independent-owned liquor stores. And the talk at that time was that Kansas was looking at allowing them to sell, the snack stuff and soda pop and whatnot. But I don't see any of that language in this.
This was the compromise. So the
So
original.
the pork of the small guy gets screwed.
Well, I think the compromise was that at one point they were looking for, like Missouri allows wine and liquor in grocery stores. So I think the compromise was to only go as far as 6% alcohol at this point. But yes, there are no of those other changes.
Actually, I believe they did, they are going to allow the liquor stores to sell some of those other items.
Okay, that'd be great if it did.
Yeah, but
Because they're gonna
but the
lose sale
state,
on the beer.
yeah, the state still regulates those completely, ABC. So cities, and municipalities regulate the CMB.
Right.
So those are the things that we have to change. Those
Well, I
other things
understand
that,
that
yeah.
part, yeah.
So those things aren't going to change in our ordinance because they are regulated by the state CMB, or I'm sorry, ABC. So those won't affect our ordinance in any way, but they will be able to do some of those additional sales.
Okay.
Well, that was the last item on the agenda. Any discussion or comments among the commissioners?
No, sir.
Commissioner Dedeke?
I'm good.
I did have something that I just wanted to discuss briefly, but, we're going into the fourth week of our national government shutdown and shutdown of the government, and it is affecting some of the employees here who belong to the Bureau of Prisons. And it's has to be creating a great hardship for those people and their families. So I was just thinking that would we want to, put a letter together, not political or anything, just saying that, we support, to show our support for our Bureau of Prison employees, that our two senators and our congressional Congressman Watkins for the 2nd District, that they do everything possible to reopen this government as soon as possible. So I just wanted to throw that out, and they're an integral part of our community, and I personally would vote would favor, having a letter of support that that could be put together and that we could, send to that congressional delegation, so.
Yeah, if we stay with language similar to that,
Yeah, I'd be okay with that, as long as it's not political.
Yeah.
Yeah, that's
Okay, yeah, good, okay, thank you.
we'll do.
Any comments, Mr. Paul?
No, sir.
All right. Well, there's no other comments. Ms. Carla?
Nothing.
All right. Meeting's adjourned.
Good job, first study session.
Yeah.